I think one thing is to share with everyone that what motivated Tanzania to combine MDA for trachoma, vitamin A, and other interventions. So as we may all understand that globally, the funding landscape has been changing. So one of the measures that Tanzania has taken is to increase efficiency in terms of how we operate, in terms of how we run our business. So because there are already interventions that were earmarked for or geared for outreach services for other conditions, including vitamin A supplementation. So we made use of that, and we integrated as well MDA for trachoma. So almost same resources were used, but also the same staff were empowered or skilled to make sure that they also provide MDA for trachoma alongside vitamin A, but also STH. And this also, another thing that also motivated us was the whole urge of strengthening systems. Because when you integrate, it's like you're creating, you're building your systems, you're strengthening your systems, but you're also creating resilience for your system. So we thought once we do that, and the system responds, it means we'll not have to continue doing these interventions vertically. It will just one approach, taking one approach using the very same system, but at the same time strengthening your system so that they can respond or they can take care of all other interventions that you're doing. But as I said, we also wanted to do this to avoid verticalization, because remember, initially when we had, I would say, adequate funding from different partners, different donors, it was like every intervention was being conducted in silo. But this time we thought, let us integrate, avoid verticalization for sustainability, because the meager resources that you have, you make use of them for all interventions. And how we are going to make sure that this approach is sustained well and replicated. Tanzania, the healthcare delivery system has got, I would say, two main parts. One is the central government, which includes the Ministry of Health, but also the Ministry of Finance and other sectoral ministries. But also we have the local government authorities. These are the ones that are mainly for implementation of various policies, guidelines, and standard operating procedures from the sectoral ministries. So one thing that we've done to make sure that we sustain these services, but also we replicate to other councils, because this one was done in a few councils. I think it was like a pilot in 3 countries, in 3 councils. And so the aim is to replicate in other councils. One is to create a budget item line in what we call the CCHP. CCHP stands for Comprehensive Council Health Plan. This is a plan that includes everything that has to happen in a particular council as far as the health sector is concerned. So initially there wasn't that budget item line. Now it has been created, and what it means is that if you create a budget item line, it's like you're now forcing, or you're telling the councils, these are subnational levels, to set aside a budget for that particular budget item line from their own sources. Could be their local government revenues, but also the central government budget, but they have to create a budget item line and fund it. And the other thing is that even within the central government, we now also have a budget that has been created for supervision, monitoring, and all those activities that are conducted at the national level. So both at the supervision, overseeing level, but also at the implementation level. And for those who are following our health sector budget, which was submitted, I think, in May in the Parliament, there were 10 priorities. And lucky enough, NTDs was one of the priorities that received attention in terms of financial support, but also resources, other resources, including human resource training, etc., etc. So we are very optimistic that by putting it as one of the priorities, this is how we're going to sustain, but also we're going to replicate into other councils. And this does not mean that we'll not continue working in collaboration with our partners and our long-term collaborators. It is our hope that our collaborators and our partners, both from within the country but also outside the country or globally, will continue working with us, especially to support the government in areas where we still have some financial gaps. So as a government, we've done what we're supposed to do. We've put some substantial amount of budget, but we believe that our partners also and collaborators will continue working with us to make sure that, we sustain the gains. Yeah, because so far there's a lot that we've achieved together as partners, government and our partners. So we believe that we have every reason to make sure that we sustain all those gains and we replicate the best practices, to other areas. But when you're talking about integration, we have other disease interventions that have been conducted in this country for quite some time, including malaria, HIV, tuberculosis, but also non-communicable diseases. So in order to leverage the use of resources, we will also be integrating NTDs, in such interventions. Because when you go out there, let's say for outreach, you meet the same people who could be having a lot of other conditions apart from HIV, TB, malaria, and NCDs. So we also use leverage on those outreaches, but also the resources that have been allocated for those disease conditions to make sure that we also address NTDs, which is also a disease of priority, because our target is to see how best we can eliminate come 2028. So what would advise other countries is that they should also look at how they're going to integrate these services, within their context. Because you can't say that you have one size that fits all. Every country is different. So integration is integration, but it has to focus on your specific context. For Tanzania, this is our context, and we thought this is the best approach. So other countries also can integrate. This will bring efficiency, okay? But also it will bring about what we call community-centered approach or focus, rather than dividing communities in disease-specific conditions. It's like now you'll be looking at a person as a whole. Okay, you go there, you educate them, you intervene. If anything, there's anything to do with NTD, you do it. Anything to do with NCD, you do it. Anything to do with any other communicable disease, you do it at the same sitting, using the same staff, but using the same facilities that are available. And that will ensure efficiency in terms of resource allocation, but also appropriate use of time, but also appropriate use of the constrained human resource that we have, including all other resources. So maybe other countries can do I think a quick assessment to find out how their health systems are structured, how their other interventions are being conducted, and see how best now they can integrate in those ongoing interventions to also elevate the profile or include NTDs.